What's up, everybody, and welcome to this week's edition of DaVinci Cases. Alright, so the way this works is we've got a clinical case followed by a board-style question. So we're going to go through the question stem, point out the relevant clinical findings, take a look at the question and the answer choices, and then kind of divert for a minute and go through the relevant concepts to answering the question. Then we'll come back and apply those concepts that we went over to answering the question. Alright, so for this case, we have a 63-year-old man presenting to the emergency room because he's been experiencing a severe headache, left flank pain, and gross hematuria for 2 days. So we've got an older guy, he's coming into the ER because he's got this really bad headache that won't go away. He's got some left flank pain and then gross hematuria. So the flank pain, definitely want to be concerned for a stone possibly. You could also be concerned for some type of acute kidney injury, kidney infection, like a pyelonephritis type picture. But the fact he's got gross hematuria too, definitely want to be worried about cancer or malignancy here as well. So his vitals in the emergency room are 38.3 degrees Celsius, so he's febrile. Fever could be due to infection, could be due to cancer as well. Heart rate's 87, so he's mild. He's within normal range, a little bit high. He's got blood pressure of 145/86, so he's mildly hypertensive. Respiration rate of 15, and then his O2 sat is 96%, so he's breathing well on room air. Physical exam is notable for left flank tenderness, which confirms his symptoms. And then he has bilateral lower extremity edema. So you could have some type of underlying kidney failure picture here, or heart failure, or even liver failure. It could be or something that's more causing like a physical obstruction or a clot or something like that in the venous system. Again, we just kind of have to keep reading on to see how this all comes together. His labs are notable for a hemoglobin of 22 grams per deciliter. Note that the normal range is 13.5 to 17.5, so this is elevated. Even though he is urinating gross blood, he has gross hematuria, he's not anemic, he's actually got an elevated hemoglobin, so he's got polycythemia, which is interesting here. He has a past medical history of hypertension, coronary artery disease, and diabetes mellitus, so he's got a lot of cardiovascular risk factors. His medications include lisinopril for his blood pressure, atorvastatin, which would be for hyperlipidemia or for patients with high-risk coronary artery disease, and metformin for his diabetes. He has smoked 2 packs of cigarettes per day, so another cardiac risk factor. Also a significant risk factor for cancer. Remember in the beginning here when he first came in, when looking at the symptoms and exam, we were also worried about malignancy, so extra worried here now because he's got this risk factor. He's been smoking that much for 35 years. He drinks 4 beers per day, so he's got moderate alcohol intake as well, and then denies illicit drug use. And so the question here is, which of the following is most likely secreted by this patient's pathology? So, and then he gives you a list of hormones. So what it's probably looking at is some type of paraneoplastic syndrome, which is essentially where a tumor oversecretes some type of molecule that then throws off the patient's physiology. Definitely has polycythemia, so you want to be worried about that. Overall, we want to figure out what type of cancer it is, because that can really also help point us in the direction of which type of paraneoplastic syndrome this patient has developed. The big thing here is you are probably concerned for bladder cancer versus, let's say, a renal cell carcinoma or kidney cancer. I just say renal cell carcinoma because it's the most common. It's typically seen in older men, especially with a significant smoking history as well. They present with flank pain, gross hematuria. Bladder cancer could theoretically cause a obstruction that leads to hydronephrosis and would cause flank pain. But typically, classically, when you see flank pain with gross hematuria, you're going to think of kidney cancer. So we're going to summarize this all up like we usually do. Older man with multiple cardiovascular risk factors, presenting with a severe headache, left flank pain, and gross hematuria. He's febrile, tachycardic, hypertensive. He's got flank tenderness and bilateral lower extremity swelling. His labs are notable for polycythemia, elevated hemoglobin, and then his clinical picture suggests a urinary cancer with an associated paraneoplastic syndrome. All right, guys, we're going to take a quick break from the case right now to let you know that DaVinci Cases is brought to you by DaVinci Academy, which provides online video courses for the medical basic sciences. These courses are taught using a variety of teaching methods, including bullet point outlines, diagrams, radiology images, and chalk talks to explain the fundamental concepts. We then teach the application of those concepts to numerous clinical pearls that are frequently tested on medical school exams and the USMLE. Our video courses are available on our website, dviacademy.com, as monthly subscriptions starting at $9.99 per month. Each video course has a corresponding outline format textbook as well. You can find the link to our website in the description below. Also be sure to use the discount code DC20 to receive 20% off any of our video courses. Now back to the case. Let's dive here a little bit into renal cell carcinoma because there's actually a lot of paraneoplastic syndromes that are associated with renal cell carcinoma. Remember, this is a kidney cancer. It's the most common. Again, it's typically found in smokers, presents with flank pain, gross hematuria, often can have fever as well. And grossly, it actually looks kind of like a fatty mass. So that's why we've shown it in yellow here. And as far as what types of hormones it can secrete ACTH or adrenocorticotropin hormone, which will lead to hypersecretion of cortisol. Remember, ACTH is normally secreted by the anterior pituitary, which then stimulates cortisol secretion from the adrenal gland. So those patients are going to have Cushing's syndrome. They can also secrete erythropoietin, which is a hormone that stimulates red blood cell production in the bone marrow, which can lead to overproduction of red blood cells and an elevated hemoglobin or polycythemia like we see in this patient. Can oversecrete renin, which then overstimulates the renin-angiotensin-aldosterone axis, leading to hypertension and increased sodium and water reabsorption and potassium secretion. Can also see parathyroid hormone-related peptides secreted as well, which acts like parathyroid hormone and stimulates reabsorption of calcium. So you can develop hypercalcemia and also stimulation of osteoclasts. You can have bone breakdown as well. The other thing that renal cell carcinoma does, as we can indicate here, is it can actually track up along the renal vein and actually compress or even invade onto the IVC, which leads to IVC obstruction. If you have IVC obstruction, remember here's your iliac veins coming in here. These are coming directly from your lower extremities. So this can impede venous return to the heart, causing backlog of fluid into the lower extremities, which then can lead to lower extremity edema, which we actually see in this patient. So the fact that this patient has flank pain, gross hematuria, and then the fact that they have polycythemia and lower extremity edema definitely points much more towards a renal cell carcinoma picture here. So if we come back here, the kicker here is the polycythemia, and then the fact that he has this lower extremity edema. So these two findings here is what kind of points you away from urinary bladder cancer to renal cell carcinoma. The other thing is left flank pain is much more common in renal cell carcinoma. It only happens in bladder cancer in those scenarios where you'd cause significant obstruction. It's not the classic presentation of bladder cancer. Bladder cancer just usually has painless gross hematuria, and that's kind of about it. And then it's really just a matter of looking through the other risk factors. The other thing here is that the patient has this severe headache. Could be a symptom of his polycythemia as well, because it essentially increases the viscosity of your blood as well. So if we look through here, ACTH can be secreted by renal cell, like we talked about, but it's going to cause Cushing's syndrome, where you'll see hypertension, weakness, fat deposition in different places, such as the face, abdomen, upper back. Oversecretion of aldosterone is seen with adrenal tumors, which will cause oversecretion of aldosterone will cause increased reabsorption of sodium and water, and then increased secretion of potassium. So you can see hypertension and hypokalemia. Cortisol is obviously oversecreted by ACTH, but it's not directly secreted by the actual pathology in those cases. But adrenal tumors can oversecrete cortisol, and that can also lead to Cushing's syndrome, as we described above in choice A. Renal cell carcinoma can oversecrete renin, which would result in overproduction of angiotensin II and aldosterone, leading to hypertension and sodium retention. Again, even though he's mildly hypertensive, he has a history of hypertension. He does have some lower extremity edema, which could make you suspicious for some sodium retention. However, the fact that renal cell can also just invade the IVC. The other thing is that the polycythemia, that's just clear and cut, which kind of comes to our next answer choice, which is erythropoietin, which is definitely can be secreted by renal cell carcinoma, causes increased red blood cell production, leading to secondary polycythemia, which can present with severe headache, fatigue, and bleeding. So this patient had a severe headache when they came in. And then lastly here, parathyroid hormone-related peptide can be secreted by renal cell carcinoma, but that would result in hypercalcemia. So what we have here is a patient that most likely has a renal cell carcinoma invading the inferior vena cava, leading to lower extremity edema and oversecreting erythropoietin, causing a secondary polycythemia. All right, that's all I have for you this time. Be sure to check out all the DaVinci Cases videos available on our YouTube channel and our website, dviacademy.com. The PDF notes for every DaVinci Cases is also available on our website. Also be sure to check out our podcast, The DaVinci Hour, where we interview attendings and residents across medicine to learn more about their experiences, their specialties, and to get their insights on navigating a career in medicine. You can find the DaVinci Hour podcast on our website or any platform where podcasts are found. Lastly, you can find all of our video courses and corresponding outline format books on our website. Don't forget to use the discount code DC20 for 20% off.